I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Father, as we come together as a commission this morning, we ask your guidance in the decisions we make for the county. We also ask guidance, Lord, for our state leaders as well as our national leaders. Help us all do the right thing, Lord. We also ask for rain. Again, we always need rain in western Kansas, and again, we're at that point. In Jesus' name we pray. Amen. Amen. Well, good morning, all. We have a nice crowd in the commission chambers this morning. It's well appreciated. Today is a work session to deal with a Spark spending plan adoption. And online, I am sure Jeff and Alex are there. And so I think without further ado, Jeff, if you're hearing me, I'll let you take over.
Thank you, Commissioner. Good morning, everybody. Thank you for the opportunity to kind of present what really has been a very collaborative process to all of you as a follow-up to Monday's meeting as well. So what I wanted to do is just kind of quickly run you through kind of the direct aid plan and what we're looking to accomplish today. What we really need to accomplish today is make sure that you all as the commission are comfortable with what we're going to present here, and then provide authorization to Robert to sign and transmit the direct aid plan and the reimbursement elements when we send it to him later today in the full final format. So what we have here, just kind of as a reminder to everybody, our funding prioritization roadmap, this is what the state of Kansas asked us to do. Try to, look at these four main elements, make our institutions as whole as possible, really protect the health of Kansas, revitalize local business, and build resilient communities overall. And I think what the plan that we've laid out here for you today really does that. So when we started looking at all of the funding elements that were here, we really came back to four guiding principles, and this was consistent with what we had learned all throughout with your culture and with really what your desires were for these dollars. First off, get the aid to where it's needed most. Make sure those that were most vulnerable, most impacted, that they had the need that they needed. Really address the gaps in the COVID-19 response. The pieces here that are highlighted here, and I'm assuming you're not seeing my screen. Does that fix that? Okay. So that, now you'll understand why I was pointing off to my left, because I thought you were seeing my screen. Apologies to everybody. Just kind of, just to bring it back, this is the slide that I was talking about in terms of prioritization. And now we're back to guiding principles. So, we're really trying to, target the aid where it's needed most, address the gaps that we saw. I think there were significant gaps that were, I think as Doug said, from an IT perspective on the county level, they used a ton of duct tape and bubble gum, and there's some things that we have to do now because we're out of duct tape. So there are going to be pieces that you'll see here that are significant dollars because that's what's needed to really ensure that in the future there is no challenges as it relates to these things. And we really want to set up the county for future success, and that's more than just the entities that the county proper. It's every entity within Finney County. And then lastly, we kind of looked at maximizing the dollars all around and kind of lived by this principle. If it's eligible somewhere else, get it there. So we've reserved money consistent with what we've said on Monday for those reimbursable items that are separate and apart that could be pursued through other avenues. And really the end result is what's today, presented to you today is reflective of the needs of the community at all levels. We're looking forward to future grant programs that may be coming out. One of the things that we discussed yesterday with the staff is the round $2. And I heard some of you talking about it right before we started. If there are around $2 that are going to be eligible for some of these items, we want you to pursue those and then we'll keep some of this money in reserve and pay it out as proper. One of the most important things to remember is that this plan is really a living document. What it says straight on the direct aid plan is that it's a strategic planning tool that really is designed for the state of Kansas to understand what Finney County is doing and make sure that there's consistency with the grant guidelines and everything else. But really, it's a planning tool for the county to be able to leverage dollars out. So again, our goals for the program budget here were really 50% for reimbursable items that were incurred between March 1st and July 31st. And those are the ones that are properly documented. One of the most important pieces in here too is that they don't have to, all of those costs between March 1 and July 31st don't need to be on this August 15th report. There is an additional bite of the apple on September 15th, and we're going to talk about how we're going to use that because I think two things. One, there may be more dollars that are available, and we may be able to prioritize additional items. And two, we may have some ideas on different funding pieces that have been fulfilled at this point. And then really, to add a third as well, there are some expenses that we did receive through the portal and through different avenues in terms of people sending them in to our team that just were missing pieces of documentation, and we've been trying to follow up fast and furious, but we wanted to make sure that what we presented to the state of Kansas was full and complete. Then on the right-hand side, the agency relief grants, the COVID-19 response and recovery grants, and the household emergency relief program, that 50% is still to be announced dollars. And pending approval from the state of Kansas, these grant programs will be announced in September, middle of September, and before October 1, so that for example, local businesses that have been significantly impacted by this can apply. And we have those funding ranges that we really talked about on Monday. And it's designed to get the aid where it's needed most, as we mentioned. So the final funding budgets that we've looked at are, we've looked at the $10.9 million that the county has and focused for reimbursement that were already incurred or contingency items for things to be spent is right about $1 million. The county direct aid plan will be, $4.4 million. And this direct aid plan, some of the major things that it focuses on are, improvement of county IT systems, other items, and making sure that we really are, we have a contingency in there for the health department if dollars aren't funded by the KDHE grant, because they're pieces for contact tracers and additional public health staff that really are the key things that are necessary should we have an additional surge later on. Then for those other three programs that will be application processes later on, the agency and local government relief grants are $2.1 million. The COVID-19 response and recovery grants are $2.1 million as well. And then we've set aside just about $1 million for household emergency relief program. And really, within those three grants as well, there's going to be an opportunity to have some outreach specialists to make sure that those individuals that are eligible for that reimbursement actually receive those reimbursable dollars. So for example, on the household emergency relief program, we intend, and have built into the budget of that program to have an outreach specialist that can be engaged, embedded in one of the local nonprofits, and will receive reimbursement. And then they'll go out and work with the community to make sure those that really need the aid and need it the most will receive it. Additionally, when we talk about the COVID-19 response and recovery grants and really are targeting some of the small business elements, those are going to be, again, have an outreach specialist embedded into it on a short 4-month position. And this person can be embedded in, Downtown Vision, for example, or they can be embedded in the, Finney County Economic Development, depending on what's necessary for the program elements later on. one of the major pieces here is that the plan that you're going to present to the state today, no expenditures or reimbursement can happen until the State of Kansas Spark Committee and Finance Task Force review these items. So, really what we're doing today is we're not cutting checks. What we're doing is we're telling the state of Kansas, this is where we're spending our money, this is how we're spending our money, and these are the programs that we're leveraging out. And just kind of to remind you of the timelines, the August 15th deadline is today. The goal is to produce that direct aid plan, share that out, and submit that first reconciliation. And we're going to submit those dollars that are only those dollars that are most critical, that have been properly vetted and everything else. We're going to move the remaining reimbursement dollars to the September 15th timeline, because the other hope within this is that we're really hoping to have additional documentation and additional dollars. We're hoping that the health department hears back from KDHE that everything's funded, and we have all the dollars that are possible here. So then it opens up additional dollars to push out those reimbursements for everything that's happened before July 31st. And then we have the rest of the reconciliation done. As I mentioned on Monday, there are some reconciliation items that, the timeline may extend, but on the federal level, we don't know, they haven't made that adjustment yet. So we really are trying to, anticipate, we're trying to hope that they do, but we have to plan that the dollars will end December 31st. With that, kind of just that overview, I wanted to open it up to any questions that anybody had from the commission about what we've presented.
Gentlemen? Jeff, we're pretty quiet here, I think, so.
Okay. So is that a good quiet, Commissioner?
Sounds like we're in agreement so far, yes.
Okay. So that's that's our presentation in terms of what's going on. Where would you like to go next? Do you want me to open up the direct aid plan on my screen and show you the specific program budgets and talk through some of those items, or where is the high level overview where you want it to be?
That sounds like a great plan, Jeff. Yeah, give us a little more breakout each. We'll need reimbursement.
Stand by, just stand by while I switch screens, okay?
While you're pulling up your information, Jeff, I point out we have quite a room full of people here. A lot of our sister organizations and our community partners are here watching your presentation as well.
Great, and I'm actually really excited that we've had that level of community support and participation. I think that the reason that we have such a robust plan laid out is because of the input of everybody that is in the room. Being able to meet with a lot of individuals, but also seeing those dollars, from a community needs, you're seeing those requests from a community needs assessment perspective has been really, really critical to making this a successful plan that I think we're going to present to the state of Kansas. Okay, so what I've pulled up, can you all see my screen again?
Yes.
Okay. So this is the form that we have to submit to the state of Kansas upon your approval today. Again, like I highlighted, I apologize. It's probably pretty small for those that are sitting in the audience. It is pretty small. This is strictly a planning document. Okay, we're going to go to we'll start on the planned independent expenditures report. This is, these items are the items that are the county's dollars that are going to be put into this plan to help engage and expand capacity. So right now we've got $4.4 million in here. And as you see, there's, elements such as, a vehicle messaging board, radios that were kind of after action items from the initial testing site, down at the fairgrounds, portable lighting equipment, a generator. There's some expenditures for HVAC system upgrades to produce, to avoid challenges within the jail for disease transmission. There's some equipment and hazard pay for emergency medical services that reduce the disease transmission, or also, an example, in regards to the port account machine, ensure that all responders, and then it's not just even the county that will get use of this machine. They will be able to fit test on all of the masks that everybody is using for this. There's, as I mentioned to you before, these line items for the health department, which they include a COVID response team. These are nurses, disease investigators that are going to be doing contact tracing. These items are likely going to come from KDHE, but they're so critical to the overall, the county's success in response to this disaster. They'll be able to go for that. There is elements to improve some of the county facilities as it relates to doors and touchless soap dispensers and those things that are really not eligible from other grant programs. And then one of the major expenses is adjustments to the county's information technology infrastructure. I think that was one of the biggest challenges that was reported to us, is that from a county employee and the continuity of county business, you weren't able to continue that. The large expenditure here is really the fiber project targeted just at the public health infrastructure within the county. So it's a fiber run in between the health department, the fairgrounds, the admin building, and EMS. And unfortunately, fiber is expensive. We're going to try and pursue this under round $2 as well, but it's one of the most critical elements that are a piece here that we felt it needed to be included. So if it, and I think that's another important point to make for everybody. If there is something here that is paid for on another grant, there'll be more reimbursement dollars made available, or they'll be shifted to the programmatic aspects, later on, in this approach. So the next thing is that the reimbursement program, as I mentioned, we've got $1 million earmarked for that to reimburse for those items that have already incurred. And we've got tens of thousands of dollars that will go to multiple of the organizations. Again, if there was a different grant that was eligible here, and we want them to go through that. And there were some items that we have some further investigation to go on, where the biggest thing for this reimbursement is it's dollars you've already expended, not dollars that you need in the future. So there were some pieces that we got quotes for, that the documentation turned into us was quotes, and we couldn't figure out if it was expended yet or not. And it has to be expended within that March 1st to July 31st timeline to get reimbursed. So we have some follow-up to do with some of the agencies, and we'll look to include those on the September 15th submission. Next is the Household Emergency Relief Program, and here's kind of more of the budget breakdown here. And again, what we tried to do is we put in both a program coordinator and a program communication assistant. These two individuals will be embedded within a nonprofit. We'll do a solicitation out to the nonprofit to see who might be, have the operational capacity to take on these two positions for 4 months. We'll provide computers and everything else that they need to be able to be successful. And we'll end up trying to deliver almost $1 million of aid out to those households that need it most. As you remember from the presentation Monday, from a programmatic design perspective, we've put a maximum household award of $10,000. And the way we derived that is we looked at the impact of of COVID-19, and we said, for a 4-month period, we're going to look at 50% of the median income in Finney County being available to these community members once everything is properly documented, as we showed on Monday. The next piece is the COVID-19 Agency Operational Relief Grant, and really the whole partnership program here. This is an additional bite of the apple here and this is really small businesses, nonprofits, really to cover the costs that were, such as operating losses, business interruption. We can't do revenue loss, but we can do grants to kind of close some of those operational challenges that have been experienced. And really looking at some working capital cost of additional PPE, for those, non-FEMA eligible entities, those types of things. We put in a program coordinator here to make sure that we're reaching out to all the organizations, making sure that, it's a very personal touch for a lot of things, but really overall looked at $1.2 million out to kind of nonprofit and other organizations, and then, $820,000 of aid out to local governments and also the school districts, those types of things. Overall for this program, we've earmarked that $2.1 million like we discussed. The final program that we're going to look here is the COVID-19 Response and Recovery Program. And this is really designed to give maximum flexibility. And this is not looking necessarily retroactive. This is more trying to look forward as to what actions can we take. And there's been some tremendous proposals that people have put in for these dollars. And this kind of just allows everybody to have a bite of the apple when we put these out. And when I say there's been tremendous proposals, it's really been in those one-on-one conversations. It hasn't necessarily been formalized, but what we'll do is have a formalized process so that everybody can submit their proposals and decide what really makes the most sense to move the community forward. There's been some various things discussed. Finney County Economic Development, for example, talked about some child care proposals and some additional items that can go in here. Again, this is, I know this is probably tough to see on the screen, and I apologize, but we put, $2.1 million in here with some additional support, so there'll be more than $2 million available for this. Okay. Overall, I think that covers the pieces that I was trying to show out to you. And I would again open it up for any questions that you all may have.
Jeff, this is Commissioner Drees. I'll start off. FEMA reimbursement seems to be very important. It is very important. Have you kind of subtracted off what you think can go through FEMA off of that $1 million reimbursement side, or is that lumped in with that?
Commissioner, yes, we have. We've actually lopped that off, and pulled in a little bit of a contingency to the largest extent that we can. And if we, Robert has authorized is any eligible organization that is applying for FEMA public assistance, our team will help you through that process. We'll guide you through, we'll get access to your portal and help you make sure that we make the most cogent eligibility argument that there's there. Because we are hearing from nationally, where FEMA will say, oh no, that's not eligible. And then you pull out the policy and it's black and white and it's eligible. And you show them the policy and it fixes the challenge. So we're gonna help support all of the agencies that are eligible for FEMA through the FEMA process at the behest of the county. Because it is, again, we want to try and make the community as whole as possible. We want to make sure these dollars go as far as possible. This is a tremendous opportunity for Finney County. We want to make sure that we're leveraging every single avenue that's possible here.
Okay, thank you. Fellow commissioners?
Jeff, once we adopt this policy, we're not locked into the amount of money in each category. We can move them around, correct?
Yes, sir. You can move them around. If needs develop in October that we didn't anticipate, we can move the money around to make sure that we meet those needs.
Okay, thank you.
Yeah, and specifically, Commissioner, we tried to craft this program with that specific in mind, because there's things that we're going to experience this fall that we haven't anticipated.
Jeff, Commissioner Clifford, on the coordination of the housing assistance, do you envision us doing that by MOU, just so that our own policy would be communicated to the nonprofit who coordinates that? For instance, if you gave me a $10,000 household assistance check, I might buy a pickup truck, but the 4 months rent and arrears ought to be paid to the landlord first, from my perspective at the commission. So I just wondered how you envision us handling that.
Commissioner, that's exactly how the program is designed, so that the individual that is eligible for that household assistance doesn't receive any of the dollars. And actually, the county will be able to control all those dollars through the reimbursement portal. What that MOU with that individual, with that nonprofit that I mentioned would do is it's really outreach staff. It's folks to work with underserved communities that may have the most need, to make sure that people are aware and have the assistance that they need to really apply for the project, the program. The no assistance check would be paid directly to that individual. It would go to the landlord, the utility provider, for example.
Is there food assistance in that money?
We can put some food assistance elements in there, but it wasn't necessarily, if they're behind on bills from a grocery perspective, that's something that we can definitely work in there as an eligible item.
Thank you.
Jeff, this is Juan, and my question is back to the FEMA for a second. Do we have any idea, or any, not idea, but any estimate of what the projected FEMA dollars could be if the applications to FEMA for Finney County through the different entities is approved?
Yeah, it would be a couple $100,000 that from what we've seen thus far, and there's still some additional investigation that's needed to be able to figure out those exact numbers. Our focus, Commissioner, right now has been to, given the very, very tight deadline, is to get the Finney County direct aid plan done first. And then we're going to go back starting, next week and make sure that we hit all those FEMA items. Steve, on the county level, Robert, Dory, Steve, and a number of the other folks have already, we had a meeting already about FEMA public assistance, and we're going through next week to start to get those submissions in and get those prepared, because we want to get those determination on those dollars as soon as possible.
But your guesstimate or estimate is around 200,000 if they were all approved. Am I hearing you correct, Jeff? I'm just trying to clarify.
I don't have, I'm hesitant to give you an exact number, Commissioner.
Oh, I'm not asking for an exact.
But it is in the hundreds of thousands of dollar range.
Okay, thank you.
Yeah, it's a significant amount of money to the point where, it has a significant bearing on this plan. So we want to be able to do that. And you can reprogram money later on, to cover that local cost share. And it's actually one of the things that's accounted for in here.
Okay, thank you.
Jeff, this is Dave with a kind of a follow-up question to what Commissioner Larry Jones asked. If an item, you used an example of the health department having maybe access to some funding from something other than this project. If that does not come through, then we can return to the Spark funding to try to fund that. Is that correct?
Absolutely. And that's why, just given the criticality of the item to the COVID response, that's why we left that in here. We do think that the KDHE grant is going to be a thing that goes on, it gets approved. So it is a positive all around. So if there is, we've got it accounted for. If they get reimbursed, if they get authorized for the grant, we'll have more money to go out into our programs.
Okay, my reason for asking that question is there are some grants other than FEMA and KDHE, and I'm assuming some of the folks sitting in our chambers today might be eligible to seek a grant or some reimbursement from some funds other than FEMA or the Kansas Department of Health and Environment. Do you kind of have a list of what is being requested from our entities in this county, and then a list perhaps of potential grant sources?
You know, Commissioner, that's a fantastic idea, and what we'll do is we'll take that as a due out, and we'll create that list, and if we see those reimbursable expenses that have come on, and we do think they're eligible somewhere else, we'll do that in a follow-up communication either later today or early next week.
Good. I appreciate that. Thanks, Jeff.
Yes, sir. Jeff, this is Lon again. A follow-up question I forgot to ask is when you and I visited in person when you were here a couple weeks ago, we talked about the difference between no interest loans and grants, and all of the terminology you've been using is grant oriented. But is there funding available beyond grants that's in the no interest loan category?
So I'd actually recommend, and I'm using grants specifically because setting up a loan program can be complicated with these Spark dollars because of the time frame that's included there and some of the requirements when you have kind of a revolving loan fund. So that's why we really tried to shy away from no interest loans in this regard, and we really just focused on grants.
Yeah, I just felt that needed to be clarified, and I appreciate you doing so. Thank you.
Further questions? Robert, do you have any observations here for us?
Just in summary, some of the things that Jeff touched on that the county's doing in regards to trying to find alternative sources for reimbursements in some of the direct aid plan spending. For example, we'll be making application to the Phase 2 program. I know it's a competitive program for network infrastructure, but that in itself could free up some dollars for the county's allocation of the Spark grant in the tune of somewhere around $1.4 million. And additionally, what Jeff talked about with the health department and visiting with our health director, that one of the sources that she has available to her through KDHE is in essence a direct stipend, if you will, to the county, and that equates to somewhere a little over $360,000. So those are the types of things that the county is looking at in regards to trying to free up more of this money for programs for the Sparks grant. And I know that both Jeff and myself is trying to encourage that be the case, throughout the entire community, so we can make these resources go further.
I think that's a key statement there. Use these other sources as much as we can so these dollars can go to more projects in the community. Observations?
Yeah, when you talk about Phase 2, you're talking about like the broadband money that the state just freed up?
That's correct.
Because I think we're primed to get some of that money.
And that's what we're hoping for anyway, but that's our effort. We're going to make that application. Actually, Jeff's company has proposed that they work with us on telling a good story to get that. And that would free up additional money here.
Because that money has a short notice on it as well.
Yes, it does. The application process begins on the 18th.
I mean, it's right in face with what we're trying to do. And good, I hope you tell a good story.
Jeff, this commission agrees again. Do you have a guesstimate timeline when the state should give an answer to our request, and then when we follow up with the actual distributions of directions it's going to go? Do you have a timeline on that?
I like the operative words you use there, Commissioner, is should. The state should review this in 30 days. We are hoping that they review it in less than 30 days. They've hired an accounting firm to help them with these reviews, but they do have to go through 2 reviews, and every county in the state will be submitting their dollars. So we are hopeful that they get dollars in ASAP, or get these plans reviewed ASAP, and we hear back before the end of August. But their deadline is September 15th.
Okay.
So,
Very rarely, but any of our major community partners have any questions for Jeff that we have not covered? I'll open it up to the audience for the major partners of ours, college, city, school districts, so forth. I'll give you a few minutes or seconds to work up the nerve to come forward.
Brian's not bashful.
They're all bashful, Jeff. Nobody's running up to the microphone.
all right.
And they're still not moving. So at this point,
We do need some direction on how to move forward now. So in essence, you'll be authorizing them to push this plan forward to the state for their review and consideration and approval.
we're at that point.
And also to name Robert as the contact person in that same motion, correct?
Correct, yes.
Lon?
So, my question is, so what we're submitting to the state, is it the general breakdown, or is it the more specific breakdown that we saw in the charts that I'm a little bit at a loss on what we are submitting to the state, if it's this general or if it's more specific?
Jeff, you want to field that?
Yeah, it's the more specific breakdown in the Excel. It's the Excel document that I was showing you with the budgets. That is the actual document we're submitting to the state. So Robert will sign it upon your authorization, and we'll submit it into the state with the reimbursement element as well.
But it ties back to what we see in in the handout that we got back to the 10.9 million. Am I
correct?
I just
So we've
wanna make
accounted
sure.
for every dollar, and if we had another $10 million, we could have spent it as well.
Yeah.
So.
So the motion, and this is more to maybe to Robert, but the motion that we need from the commission, if we're ready to send this to the state, is to authorize submitting to the state the expenditure plan for 10.9 million and naming you as the contact for the county. Is that what our motion needs to be?
That's correct, yes.
So moved.
I'll second.
It's been moved and seconded. And since today is the deadline, we do need to make this motion. And any further discussion? All in favor of the motion to approve the plan and authorize our administrator to be the contact person, signify by saying aye.
Aye.
Aye. Opposed? Motion carried. Okay.
Thank you, everybody.
Thank you.
Jeff.
And Jeff, thank you for all your and your team's work. There's a lot of work there, and it's not over, but we sure appreciate it. Thank you, sir.
No, we appreciate you trusting us to get this done for you, and the team's worked very hard. So,
And
I'm glad we presented something that works.
And Jeff, I would also just expand that thanks to your offer to help with the FEMA applications and the other things, because there's no question that people are gonna need assistance with that.
Great.
All right, Jeff, thank you very much.
Fine.
I might take this.
Thank you, everybody. Have a great day.
You too.
Thank you.
Good weekend. Anybody in the audience of our partners have any concerns that we have not addressed? Any suggestions, comments, observations? No complaints allowed, just comments and observations.
Chairman Reese, just a quick question. Can we get a copy of the specific information that was discussed and presented today? I don't think we've got a copy of that.
Sure.
It has been confirmed, yes, we can.
Thank you.
Just request it from, can you get it? Who wants to?
Yes.
We'll get it to him.
Yeah.
Okay. Let Dory know, and she will make sure you guys get a copy.
Thank
All right. I think that's all on our agenda today was strictly this discussion, this work session dealing with the Sparks spending plan. So anything else that needs to be brought up to our attention?
We meet again Monday, right?
We meet again Monday.
Just a quick thing for the commissioners, we're having our Zoom at 1 o'clock today for KAC's legislative policy. It'll be a full afternoon session, I imagine. If you have anything that you think should be brought up to KAC for legislative policy, let me know before 1 o'clock today.
I think all
What are
those.
your lead items that what do you think?
Well, they brought back, and I didn't bring that list to me that's on the agenda, but Riley County is leading on about 3 or 4 items, bringing back the dark store question, the constitutional home rule question, a few other things. And I don't remember that there were 3 or 4. We've got like 7 specific things that have been submitted to us, but there will be open discussion about other items. Some of them are repeats of things that just haven't been done.
Didn't do
in the
last year.
year or two.
All right. Meeting adjourned.